What if it only inhibited COX-2? It would be more selective, okay? But most of these also inhibit COX-1, okay? These are chemicals, these aren't bad chemicals. These are chemicals that carry out bodily processes. So they do both, quote, good and bad things. And COX-1 is responsible for things like creating, within our stomach, they create actually a mucus that protects our stomach. Okay, so if we eliminate that, what do a lot of the NSAIDs and a lot of aspirin do to our stomach? Okay, it reduces the protective mucus that we have in there, right? And people wind up with stomach and GI distress because of it. That's one of the reasons why it does it, because it's non-selective, okay? But in this case, in anti-inflammatory, they actually reduce the COX-2, which is responsible for a lot of the inflammation. So now does it make sense when you say that it reduces prostaglandin, why that's important? That's why. That's why. Yes, Layla?
So is it COX-1, COX-2 auto the prostaglandins, or like something that prostaglandins release? I don't understand that.
Yes, when the tissue gets injured, okay, prostaglandin is released, and that mediates the release of COX-1 and COX-2, okay? Actually, it's the COX-1 and COX-2 that mediate the release of prostaglandins and leukotrienes, among other things.
Okay.
When we start talking about allergies, they also release histamine, okay? So lots and lots of chemicals. It's a very, very complex process. But remember that if we knock down the prostaglandins, okay, we're gonna knock down this process,
So that
okay?
comes before the prostaglandin.
There's even more under here, because the prostaglandins are what release the bradykinin, which sensitizes the nerves.
That's what I'm trying to get the.
Yes. So really, honestly, in this process, what you have to remember is that they prevent the synthesis of prostaglandin within that process. Okay, so if you just remember that, we're good. Okay? If you just remember that, that's due. They inhibit those chemicals.
What does the COX-1 and COX-2 do?
No. The anti-inflammatory medications inhibit these chemicals which are responsible for inflammatory response. Several of the inflammatory mediators. Yep. Okay. Yep.
Do we have to know about the
No, today you don't have to know, but know that word because it's going to come up later when we talk about allergic responses. Yeah. Okay. These are, if you remember that if you reduce prostaglandin and leukotrienes, COX-1 and COX-2 are all part of that process. Okay. The anti-inflammatories that we use, the aspirin and the NSAIDs, all reduce those. Okay. We talk about opioids. No, they don't. Okay. So if we remember that the anti-inflammatories, the aspirin and the NSAIDs, okay, mediate at the peripheral nerve endings, and they prevent the perception of pain to the brain. That's what you need to know. Okay, you got it? That's all you need to know about it. All you need to know about it. They inhibit the mediators of inflammation. They prevent prostaglandin synthesis. Okay? We're good. All right. As you're still going, I want to understand it more. That's all you need to know about it. That's all you need to know about it. Take my word for it. If you want it in more detail, I'll give it to you in more detail. I don't think you want it in more detail. Okay. All right. That's all you need to know. Okay. We know that the absorption of the salicylates takes place in the stomach and the small intestine. So anything that interferes with that absorption, which might be food, may make it be absorbed more slowly. Now, sometimes you need to take, I don't know about you, but NSAIDs or aspirin for me on an empty stomach are not a good idea. I get a stomach upset from them. So you can take them with food, but they might take a little bit longer to work. They do have some that they treat in order to be released, dispersed more readily, like the buffered ones. And they do have ones that are coated that actually make them release themselves slower, okay? So they do that for people that have problems with it, especially people like with arthritis that need to take a lot of aspirin. Their stomachs would be in big, big trouble even with food if they didn't take one that's more time released or that is coated in some way, okay? They're distributed widely through the body, okay? And if they're poorly bound to plasma protein, remember we talked about being protein binding? of the drugs. So if they're poorly bound to plasma protein, does that mean they tend to be in the blood or out of the blood? Right, okay? They're not bound to those big proteins and sitting there all stored up. They're actually being released and distributed through the body. Good. The half-life of the salicylates is going to vary with how much you take, because do we remember zero-order kinetics? Sort of. Okay, I'll remind you. There was first-order kinetics, okay? First-order kinetics were the one where you had this consistent half-life. So no matter how much you took, right, within reason, no matter how much you took, within a half-life, which might be like 2 hours, half of it was gone. In 2 half-lives, it was down to 25%. In 3 half-lives, it was down to 12.5%, okay? With aspirin, it can only, or the salicylates, your body can only metabolize so much of it at a time. So if you take a lot more, okay, it's going to take longer to get rid of it. It may take hours and hours or even days to get rid of it.
Like alcohol.
Like alcohol. Yeah, exactly. Because you have like a saturation point. Absolutely, okay? So remember that salicylates are subject to zero-order kinetics. So how much you take does make a difference. Now sometimes they use that because it actually keeps the blood levels at a certain level. So people taking that 81 milligrams of aspirin, okay, it actually means that it can hang around and keep unclouding the blood, if you will, for a steady period of time, okay, over time, even though people are only taking 81 milligrams, which is not an analgesic dose, right? You don't take 81 milligrams to get rid of a bad headache. 81 milligrams is for the antiplatelet effect. Okay, the pharmacokinetics of it, remember we talked about, do you have a question?
Yeah,
Yep.
just about back when you said about the food, taking the food and shit. So the book says like the instructions, they have those boxes with instructions.
Yep.
And it says that you have to take it with a glass of water. How we, what's the point? Like,
Of the water to reduce the stomach upset.
So it, okay.
All medications should be taken with a full glass of water. I remind patients of that all the time.
Yeah.
My mother takes pills with a sip of water, and then she also takes stuff for her acid reflux and whatever. I'm like, just drink water. Yeah, you should take it with a full glass of water because it also helps to disperse the tablets. Remember how they have to break up? Yeah, yeah. And some can be taken in, and some people can take them on an empty stomach. If you take them on a full stomach, it will take longer for it to work, but it will still work. There are some that specifically will say, some individual medications, do not take with food, take on an empty stomach, or take with food, right? You've gotten those little stickers on your bottles, okay? It really, some of that's very agent specific, yeah.
And there's some that say not take it with a glass of milk, some does with the milk.
Right, because the calcium will reduce the absorption. Yeah, yeah, it will, the caseins will reduce the absorption. We'll talk about that with some specific drugs for sure. Yep. Okay, so the buffer will make it, anybody ever heard of bufferin? Okay, that's buffered aspirin. It makes it more quickly available to the body, so some people think that it works faster. But then they do studies and tell us there's not much clinical difference, so what can I say? If you take a small dose of aspirin, the half-life is 2 to 3 hours, okay? But the antiplatelet effect is longer, that we talked about, right? If you take higher doses, the half-life can be between 15 and 30 hours, okay? Zero-order kinetics, that's what we just talked about. We know that, again, it's analgesic, relieves mild to moderate pain. It reduces fever, but actually the fever reduction happens in the hypothalamus, okay? Which is that little gland in the middle of your brain, okay? That actually happens there. So its antipyretic effect is centrally mediated in the brain. Anti-inflammatory, decreased erythema and swelling, okay? Decreased redness and swelling is related to the COX-1 and 2 suppression, okay? Because we know that whenever we have inflammation, right, we get that edema because we get the capillary permeability, we get all of that fluid released between the cells, right? Vasodilation, the heat, right? You feel the heat and the redness that's there because the prostaglandins usually mediate that and make that happen. So if you reduce COX-1 and COX-2, prostaglandins are reduced and we get that reduction of all of those things that happen, and also the nociceptors. So you get a lot of bang for your buck with that. It's also uricosuric. Uricosuric means that it reduces uric acid. but that seems to be somewhat dose dependent. And I find it very confusing that they tell us, well, small doses do this, but large doses do that. And the reason that we pay attention to that, okay, that if we're taking small doses, it may actually reduce the amount of uric acid we get rid of. So it causes uric acid retention, but large doses can make the uric acid go away. And when we talk about gout, that's what we'll be talking about. The antiplatelet effect of the salicylates, of aspirin in particular, low dose aspirin, irreversibly binds to platelets, okay? It kills the platelets for their lifespan, which is about 7 to 10 days, okay? So does that mean if you take aspirin all the time, all your platelets are gone and you're gonna bleed to death? Not exactly, okay? It means you could bleed more easily and for a longer period of time, but only about 25% of the platelets have to be remade, if you will. New ones have to be synthesized in order to have an effect of being able to clot somewhat normally, if you will, okay? And again, depending on the dose, this can either, and again, it's a little bit confusing, but it can either inhibit the aggregation, which is what we want for that reduced effect for people for heart health, okay? Or it can also inhibit thromboxane A, which again is one of the clotting factors. So that's something that stimulates aggregation, so we can do that as well. So it works by a couple of different mechanisms with antiplatelets. And when we talk about some of the cardiovascular drugs, we'll talk about this in detail. But in general, people on a low dose of aspirin that has been prescribed by their doctor, some people just go on it because they think it's a good idea, okay, not a good idea, will have this antiplatelet effect. Okay. Chemically, acetylsalicylic acid, and your book makes a point to tell you this, and I think it's mostly for patient education and for education of yourself. It actually breaks down into acetic acid and salicylic acid. And if you've ever opened up a bottle of aspirin and you get that kind of a whiff, it may be that it's already breaking down, okay? So if it's already somewhat dispersed, remember how tablets have to disperse, you're gonna get that GI upset a lot more quickly, okay? It may reduce the effectiveness, but more likely it's gonna work, but it's just gonna upset your stomach a little bit more. So that's something to be concerned about. Adverse reactions, most common is GI upset, okay? So it can be anything from a slightly upset stomach to vomiting, okay? Gastric bleeding for someone who has issues with, bless you, ulcers or that sort of thing. And remember I talked about the inhibition of prostaglandins, of COX-1 and COX-2. It inhibits both of them non-selectively, meaning that the good COX-1 decreases or increases the amount of cytoprotective mucus that we release in our stomach, okay? And that would not be a good thing. So if somebody already has existing ulcers, they have gastritis, they have a hernia, they have gastroesophageal reflux disease, GERD, aspirin is not a good idea for them, okay? There may be people that are on low dose aspirin because of other reasons, but only if they have these other things under control. It can interfere with bleeding, so someone might bleed out a little bit longer in taking aspirin, and again, it depends on the dose. And we know that any parents in here, or anyone that's around young children, if you suspect that a child has chickenpox or influenza, you do not give them aspirin because it can precipitate potentially fatal syndrome called Reye's syndrome, okay? It can cause encephalitis, inflammation of the liver, toxicity of the liver, and this could be fatal. So if you're quite unsure what to give your child or a young person that you're in charge of, when they have symptoms that you're not sure of that may be related to flu, don't give them aspirin. The effects on the liver and the kidneys as well are pretty rare. They're pretty rare. They can cause, hepatotoxicity or possibly kidney effects, but usually those are in chronic doses over a long, long period of time. But generally speaking, for the average person, that's not a problem. There has only been a slight positive correlation between adverse pregnancy outcomes and taking the salicylates, but again, related to chronic ingestion, it's pretty safe. If we get close to birth, though, it is contraindicated for a woman to take it because it can actually prolong gestation because it has an effect on the uterus in decreasing uterine contraction. That's especially with the NSAIDs, but also the premature closure of the ductus arteriosus in the heart. Okay, it has to close actually at a certain period of time. So that can happen as well. So women who are close to term should not be taking aspirin. People do have hypersensitivity. A lot of people say they're allergic to aspirin. They probably just get GI upset from it. So if they tell you I'm allergic to aspirin, say what kind of reaction do you get? Okay, and then we make sure that that's not the case. Less than 1% of people are actually allergic to it. And also people are allergic to aspirin, they may not be able to take any of the NSAIDs as well. So it's extremely limiting. So if you think you're allergic to aspirin or someone thinks they're allergic to aspirin, these are very useful drugs, so you would really want to make sure that it's a true allergy and not just a sensitivity, especially GI sensitivity. They can be toxic, okay? An overdose can be toxic, okay? And it could cause even death. Salicism is a syndrome that happens where someone has an overdose of the aspirins, and it's characterized by a ring. Tinnitus is ringing in the ear. I actually always remember this because my mom had an elderly friend who was, she was not laid off from work, but she had to leave work on disability because she fell actually on ice and hurt her back. And this woman, this was years and years ago, and she would take aspirin all the time, and whenever my mom would call her, we'd go and visit her, Aunt Grace I called her, we'd go and visit her, and we'd say, how are you doing, Grace? And she'd say, oh, I'm dizzy, I have this ringing in my ear. And I realized this woman was taking aspirin upon aspirin upon aspirin. There wasn't as many drugs back then. But I always think of Aunt Grace when I think about this. But tinnitus, ringing in the ears, dizziness, dimness of vision, it can cause hyperventilation, okay, and really very, very bad things. Children are most vulnerable to this. The least dose is only 4 grams, okay? 500 milligrams, 1,000 milligrams is a gram, so it's not very much. So for adults, it's 10 to 30 milligrams, so that means 49 children's or 12 adult tablets can be fatal. Okay, so we need to educate parents. Child-proof containers, this is why, especially when you think about the flavored types of aspirins or the liquids, you be really, really careful with it. Inducing vomiting, giving activated charcoal. I don't know if, I always had a bottle of Ipecac. Any parents in here usually have a bottle of syrup of Ipecac in your house? It's to induce vomiting. Yeah, the poison control center thing, I still have it by my phone. You should always have that there and know what's around. Keeping it safe is really, really important. So you can see the doses going from antiplatelet, which is like 81 milligrams, up to a lethal dose. It can actually go that far. So a lot of care. Yes, Miranda.
So you're saying like people, a lot of like elderly students take baby aspirin,
Right.
80 milligrams. So that's usually just for like blood thinning and stuff, not for headaches.
No, that is not an analgesic dose.
What about the 325?
325 is an analgesic dose.
So that's they're using for that.
Yes. Yep. Most analgesic doses of aspirin are 325. Sometimes they're especially if someone when they're about to undergo a heart attack, right? You've heard about people using the aspirin. Then they usually have people chew at least 2 of the 325s. We're talking about an emergency situation. So. Okay. Drug interactions, one of the major ones is warfarin. Anyone taking warfarin, Coumadin, you've heard of that? Okay, talk about your blood thinners. That's an anticoagulant, okay? This would be someone who has had a stroke or a heart attack. There are people walking around that are taking oral warfarin. Taking aspirin at the same time is not a good idea. And so a doctor would never prescribe both of them, or if they did, they'd have a very good reason to do so. But what I'm saying is if you know a patient is on warfarin, don't tell them to take aspirin, okay? Because if we tell them we're the healthcare professional, they're gonna believe us. That's not a good idea, okay? But what it does is it not only has a double anticoagulant effect, okay, the antiplatelet plus the anticoagulant, but remember how aspirin is poorly bound to protein in the blood? The warfarin is highly bound. So what happens is the aspirin knocks the warfarin off the protein binding sites and releases a whole bunch more of it into the blood. Warfarin is a powerful anticoagulant. So you have definitely have bleeding problems there, GI bleeding, brain bleeding, all that kind of